Dr. Verma, sir.
Good morning, friends. Very happy to see a large audience here. In continuation with what Professor Samra is talking about, something which we need to be sensitized about and which we need to incorporate in our curriculum. Keeping that in mind, this work was done some time back, and this was published in Journal of Management Research, and based on that, I was chosen for this award. I've been working here at Maulana Azad Institute of Dental Sciences for the last 28 years, and today it is ranked one of the best dental institutions in the country. I'm very proud of it. You all know that today we are under tremendous public scrutiny, all doctors and dental surgeon included, because not only we have to excel in our technical ability, but we also need to set high ethical standards. And how do you get that? We need to do something about it, and I think it's very important that we need to incorporate it in our educational curriculum, and we need to incorporate it in the professional development. Today, a dental professional or a medical professional, for example, a practicing doctor, his role is divided into two parts. One, he's a doctor, he's a health professional, he's also an entrepreneur. Entrepreneur means he has to be acquainted with his entrepreneurial skills, financial management, human resources, finance, marketing. And every role, this very role has different, distinctive and conflicting ethical demands, where on one side, as an entrepreneur, you have to generate revenue, and whereas on the other side, you have to be fair. You don't have to, you have to be very truthful and very fair to the patient. So there is a conflicting ethical demands. We all know that the principles of ethics are autonomy, non-maleficence, that means we do no harm to the patient, and we do all beneficence. Whatever we do is in his interest. We be justice, fair, truthfulness, and also whatever we do with informed consent, and we keep the information confidential. And we all know today, we brag about our patient. We say, oh, Amitabh Bachchan is my patient, which we are not supposed to do. What happened? This is not working. Application of ethics. Ethics are, applied not only in clinical setting, but we all know any organizational, healthcare organization, educational institutions, and even research. We have Helsinki Declaration 1964, where we have to be ethical about research. There are a range of ethical dilemmas which are encountered by day-to-day practitioners, but mainly it is patient-centric issues, treatment-related issues, professional-related issues, and some uncommon day-to-day issues which we encounter in our practices. And as a dental institution or a medical institution, we have the responsibility that we need to sensitize and educate our students. Not only we tell them, we also tell them, we also test them. How do you manage a particular situation ethically? And the question is whether the training in ethics, does it produce a better doctor? Right from wrong, is he able to discern what is right, what is wrong ethically? Keeping that in mind, this study was carried out. The setting was Maulana Azad Institute of Dental Sciences. It was done last year, September. We got the study cleared from the institutional board. All our clinical students were part of the study, and we used a closed-ended questionnaire, and the questionnaire had certain scenarios on role of doctor-patient relationship, autonomy, consent, clinical decision-making scenarios, communication as one of the tools in clinical decision-making, whether we need to keep medical records, current status of curriculum on ethics. Why this paper was chosen in public health? Because today, currently, the Dental Council of India, the ethics is part of the public health dentistry. Before we did the main study, the pilot study was conducted, and the content, validity, and reliability was tested, and the final questionnaire was then modified accordingly, and data was statistically analyzed. We had about 62 randomly selected students, age ranging from 23.8 plus or minus 9, and most of our students are ladies today, female. So obviously, large number of them were females. As per their ranking, the students, respondents felt that the patient-related issues were the main issues. And after that, there were treatment-related issues, fee-related issues, and then, of course, how a professional is expected to behave, professional behavior issues. There were a number of scenarios which were enacted in the questionnaire, and they were tested. Students were tested for that. Scenario 1 was when they were asked to evaluate clinical decision-making process involving autonomy, which is one of the principles of ethics, and respect for the patient. And dental professional has a right to refuse treatment. Most 35% felt, and dental professional is indifferent to the patient preferences. 33%, dental professional is being unreasonably rigid. 16%, and dental professional may be behaving very financially unrealistic. That means he may be, he's charging much more than what is fair to the patient. Scenario 2 was respondents were asked for their opinion when presented with poor quality of treatment done by the previous doctor. What do they do about it? 53% of dental profession felt, students felt, respondents felt that they should treat the patient without telling him that something wrong has already happened to him, and only 17% felt no, we should tell that what is wrong with him, whether it has been carried out right by the previous doctor or not. Scenario 3 was dental profession who refused to treat a patient demanding a particular treatment. In our dentistry, what happens, a lot of patients come to you and they will ask, no, I want fixed teeth. And the situation is not for the fixed teeth. Now, do you succumb to patient's demand? So what do they feel about it? 34% said that if you refuse the treatment, what patient is asking is actually being indifferent to the preference of the patient. And the equal number of respondents felt that they have the right to refuse the treatment. They said, no, if you think it is not right, you can refuse it to the patient. But most of the respondents felt that the doctor-patient relationship is actually based on all the basic ethical principles. That means the principle of beneficence, non-beneficence, autonomy, veracity, truthfulness. Students were also evaluated regarding understanding of breach of professional confidentiality. When does it become a breach? When you are conducting a breach of confidentiality? That means the information which is entrusted in you as a doctor, and 34% disclosure of the facts about the patient's clinical history was considered as a breach. And 31% responded said that disclosure of successfully managing a difficult case amongst professional colleagues was actually a breach of confidentiality. And 30% of the respondents were aware of the duration of the preservation of dental. They said they don't know, the students don't know how long they need to keep the medical records. They don't know. And only 19% of the interns were not aware of the same. And what are the records of the routine patient? What are the records of patients involving medical legal issues? 61% of the house surgeons and 45% of the postgraduates were not aware what kind of medical certificates a dental professional is entitled, he can give. So they were not aware of it. 50% believe that the current curriculum does not provide adequate training in the understanding of ethics and relevance in clinical practice. So I don't know about Medical Council of India, but we in Dental Council of India, we have ethics as part of the public health dentistry, but the understanding of ethics, how much emphasis it is given in training, they didn't know. But most of them felt that the best method of improving skills in ethics would be based on case-based learning, continuing education programs, or starting some subject or some course in dental education in the curriculum for undergraduate and even postgraduate students. But there are a variety of clinical decision-making situation in dental practice which needs ethical sensitivity. I think it is the responsibility of all the medical and dental institutions that we need to sensitize them about this issue, and not only we teach them, we also test them how well they are able to handle a particular situation. Dentist-patient relationship is the cornerstone of dental practice. All these years, patient came to us, we had a very paternalistic attitude that whatever you decided for them, they accepted, they meekly accepted. I think that's no longer done today. Today you have to inform them, and they have to consent what is good for them. They have to make a decision. But at the same time, ethical issues, mainly autonomy-related issues, arise in the determination of whether or not the patient is competent in making the decision. We say, okay, you take a decision. But sometimes our patients are not educated. Sometimes patients are not aware of it. In that situation, what do? I think in that situation, the only way to go ahead is we tell the patient, inform them, informed consent. You tell them this is good for you, I'm informing you, I'm going ahead doing it. There are treatment-related issues, mainly substandard care and treatment decision by other dentists, because dentist is mainly operative procedures, procedural. You come across treatment which is not rightly done by the previous doctor. What do you do in such situation? Disparity in age differences and its impact on practice of ethical principle. One thing which has been noted, that as a youngster, you tend to be rather unethical. But as you grow in age, in terms of your practice, in terms of your professional standing, you tend to be more ethical. Probably because stability, you think, there is no risk. Youngsters are there, they want to establish themselves, so they're more interested in patients generating revenue. Whereas as you grow, the stability, your experience, you also know with experience that what is right and what is not right. The limitation of this study was this was an empirical study, hence may not provide a reasonable framework for some future issues which might arise in future. And the students' ability to identify ethical issues and apply a reasoned decision-making approach may be different, because it's depending upon a situation. What is the challenge in front for us? To train the student in a short time. The MBBS course has been shortened. Our BDS course also, from 5 years it is shortened to 4 years plus 1 year rotatory internship. So we have to do so many things in a very short time. And how do we evaluate their competency? We not only teach them, but we also test it. How do we test it? Lack of orientation toward dental practice management. Today there are no government jobs. Most of the medical or dentists, they have to go to private practice. And when they go to private practice, they need to be acquainted to, how do they set up a practice. So I think the ethical training is much more important in today's time. Ethical values and professionalism are best measured in context of comparable to practice. That means it has to be real time. I have seen that when it comes to answering a question, we tend to be ethical. When it comes to practice, we are not ethical. We say, okay, it should be like that, but do you really do that way? So, what are the practical implications? That there is a necessity for further research on students' ethical behavior and understanding of professional dilemmas in a larger group of students. Practical approaches to improve the curriculum. Okay, you teach them, but how do we make it practical and ethically sensitive and cultural? There are many issues which varies from place to place, from race to race, from culture to culture. So that also has to be kept in mind. I like to end my presentation with, this is by a famous quote by Vivekananda, Swami Vivekananda. This is the gist of all worship, to be pure and to good to the others. Thank you so much.